The topic of BBL and cellulite, that's probably one of the hottest topics with us and our patients, because I always think it's very important to clarify to all patients seeking our kind of body contouring procedures. I always say that I call that, the little black dress procedures. It's shape procedures, but it's not a procedure for buttock cellulite, and it's not designed to be. BBL is a shaping operation which will usually not affect the way in the skin, either to worse or bad. Existing cellulite may be more prominent, but what I think is probably, sometimes it may improve, but I think more relevant than any measurable changes is that patients usually, after they have these reshaping, these large reshaping procedures, the buttock reshaping, they love to look in the mirror and, it's objectively, they notice things that have been there all the time. So it's not really our reality that cellulite would be generated by BBL in contrast. But mostly it's also with out-of-town patients a problem of some horrible lighting. You can make every cellulite look 10 times worse with the wrong lighting. But real objective changes from simple body reshaping are not really our experience. Now, our patients are usually very happy with the shape change, and they say, "Look, I want to do something for my skin too. So, what are the options?" You will have to differentiate generally between patients who have larger, like deep dimples, who often skin-retaining ligaments. These we either regraft. Many patients do BBL twice, and then you can usually get a little bit on top of this that way. If not, that is one of the very few indications when you have like a real deep dimple to work with a little bit of body filler. I don't like these body fillers too much, but for this indication, it might be good. But generally, if you really want to say, "Look, I want to get a little bit more peachy effect, I want to do something for my skin too," what is the treatment of choice in general is a skin booster resurfacing, like we do in the face, after facelifts, with many people are aware of. We do skin resurfacing treatments for skin rejuvenation. The principle is you apply a controlled trauma to the skin in form of, let's say, a controlled burn, and this initiates a regenerative process which results in thicker, better, shinier looking skin. And this is what we can do on the buttock too. There's a couple of different modalities, and I think most who are into this will either use invasive radiofrequency or ablative lasers. We are favoring invasive radiofrequency. Personal preferences apply. This is nothing new. I think in facial surgery, we've had this for many, many years, is radiofrequency needling systems. I think many in our patient community and most colleagues will know that as Fractora. We've used that in facial surgery for over 10 years with very good results. Problem being, that the applicators of the original Fractora system were relatively small, and I think they're simply not feasible for larger body areas. So that was a facial thing. However, the second generation of these devices, invasive radiofrequency devices, now comes with a bigger applicator, which is actually specifically for the body. And what we have actually found that it seems to have a very positive effect together with fat grafting. So it works a bit better if you do it together with fat grafting than if you do it without. And with new applicators, we can do a resurfacing treatment of the skin directly at the end of the procedure. How does that work? You've got this animation here where you see a body applicator that is armed with a set of fine needles which penetrate the skin. Please remember, we do that while the patient is still asleep. Interestingly, we have a so-called burst mode here where you can get a penetration depth of up to 4 millimeters. And no, it does not harm the transferred fat. And what it does, it basically, in a very controlled and a very precise and punctual way, sets a little trauma in that plane of the skin where you can expect some kind of reparative, regenerative process to appear. And you see that after doing this, you can observe some remodeling and thickening of the skin, and there's a general rejuvenation effect. And this is what gives you a better skin quality. You see here in the video how this is basically done. So the applicator goes in multiple passages over the skin. You see in the right up top a picture that is a BBL endpoint after we've done this, and if you go a little bit closer, you see many like reddish squares over the skin. That's the way it looks like at the end of the procedure. It does go sometimes significantly redder within the first day. That's actually a good sign. It's a sign that it works. And again, especially in combination with fat grafting, we find that these things work together very well. And in those cases where we've done this, we've had usually a very nice effect. It's never fully predictable how a patient responds to that, but I think out of the currently available options, it's really the best thing we can do. The recovery is I don't think for a patient would make any difference. I think if you do a BBL, you're so absorbed in the BBL that it won't matter to you too much. The fat grafting seems to have a positive metabolic effect, which makes a lot of sense because fat grafts contain a lot of growth factors. So that is actually a very logical thing. You have, I would say, 20% of patients complaining about itching and redness, which is not too, let's say, too bad, and the rest pretty much is absorbed in the BBL recovery, and after 8 to 10 weeks, you can judge for the effect. Many patients who specifically come to our aesthetic department for resurfacing treatments, be it face or whatever, usually do 3 sessions. We'll have to see in the future. I think definitely if you do that together with fat grafting, the effect is stronger. But I would consider to my plan of life, if I did this, that I might want to do another session. If you want to do the resurfacing in burst mode with the deep penetration, we recommend to do this at a twilight sedation. So wrapping it up, I stand with my word. I'm afraid, we will never have a perfect solution for cellulite. Probably during my career. After that, we'll see. We have a lot of gadgets, with I don't know, sometimes not very reproducible effects, but this is something which I consider a very strong position works. There is a very reproducible improvement, which I also contribute to the fact that we do it simultaneous with fat grafting. To improve the effect, some patients might want to add a session of that Morpheus treatment, and if you do that, I would recommend to do it under twilight sedation. Wrapping things up again, there will be, you can't just erase a cellulite. I think this is probably one of the things that is highest on patients' agenda, to get rid of the cellulite. But there is no silver dagger. I'm sorry, that's not the news I'm trying to bring here. But I think currently what we have on workable, strong, evidence-based options, that is, I think, for some time to come, the best.